Good morning, Rapunzel ladies. My name is Allison. I've been wrapping my hair with scarves for a couple years now. I saw Layla's video about wrapping with wearing a surgical mask, and it touched my heart. I am a healthcare provider, more importantly, or not importantly, but more specifically, I'm a respiratory therapist, which means I get coughed on for a living. So even prior to epidemics of a disease that I will not name, I live my life in a mask, pretty much. So, her tip about putting your shaper behind your ears, brilliant. That is absolutely what you should be doing. I have two other tips for wrapping and using a surgical mask like this that has the elastics on the ears. One tip is what a lot of healthcare providers are doing, even those that don't wrap their hair, is they're wearing headbands and they're putting buttons right here above their ears. They're just sewing a button on and then going like this and looping it up around the button. And that way you don't have to worry about trying to tuck it up over your ears when you're out in public. I just dropped my headband. Whoops. And you don't have to fuss with anything. You can just pop it on, pop it off. Granted, you're walking around with a headband with buttons on, but everybody kind of is, so it's okay. The other tip is one of our ICU nurses at my work, her sister made a whole bunch of these for everyone, which I love. It's just a crochet piece or knitted. I don't understand crochet and knitting. I sew, I don't crochet and knit. I admire those who do. So, but she put buttons on either end of this piece here, and it just stretches a little bit. And what you're able to do then is put a button on one end, put your mask on, and then go like that. And it stays very nicely. That's normally what I use at work. I do not typically wear my shaper at work right now, and I'll get into that in another video. But those are two suggestions that I've seen and used at work, and they've been pretty helpful. The other suggestion I have is that if you make your own masks or can find someone who makes them, there is a type of surgical mask out there that has ties instead of elastics for the ears. And the way you tie them is the top tie comes up around the top of your head, so it sits right above where your shaper is, and then the bottom tie ties around your neck. So that's actually the type I prefer. So I made this one, and when I did it, I made it with strings, albeit they're a little on the short side. I ran out of bias tape, but that's okay, it still works. So what you do is tie it at the base of your neck first in a bow, and then just lift this up over, push the nose piece in, and it sits, I don't know if you can hear me, but it sits very nicely on the face. Right up here, right here, and then pop this down so you can hear me again. And then in between stores, I just pop this down, and I don't have to fuss with the neck and stuff, and I can just pop it up if I need to go in anywhere. Okay, so that's my tips on surgical masks and homemade face coverings, which is what I'd say 80% of you need to be doing when you're out and about. The other 20%, those of us who are in healthcare and who are on the front lines within 6 feet of patients who are known to have a certain disease that I will not mention, or for that matter, even the flu. We are supposed to be wearing an N95 respirator mask, so I will share my tips with that mask in another video. Bye for now.